Diabetes and high blood pressure are a deadly combination. They quietly damage your body every day. Every surge in sugar and rise in pressure is a threat to your heart, kidneys, and nerves. The good news is that there's a powerful way to protect yourself. It's hidden in the nutrients your body needs, but often doesn't get enough of. Vitamins aren't just for overall health, they can stabilize blood sugar. What are these vital nutrients? Join us as we reveal the top 5 vitamins every diabetic must take. Omega-3 fatty acids. Omega-3 fatty acids are not only great for your heart, but are also essential for managing diabetes and protecting your overall well-being. But why are omega-3 so important? Stay tuned to find out. First, they fight inflammation, which is the major cause of diabetes and its complications. Chronic inflammation can worsen insulin resistance, harm blood vessels, and raise the risk of heart disease. Omega-3s, especially eicosapentaenoic acid and docosahexaenoic acid, act as natural anti-inflammatory agents, helping to reduce this harmful process. The benefits go beyond reducing inflammation. Omega-3s are a lifesaver for heart health. People with diabetes are 2 to 4 times more likely to develop heart disease, but omega-3s can help lower that risk. They reduce triglycerides, a type of fat in the blood that can block arteries, and improve overall cholesterol levels. According to a study in Diabetes Care, omega-3 supplements can significantly lower triglyceride levels, making them an important tool for heart protection. Omega-3s also help prevent blood clots and stabilize heart rhythms, both critical for diabetics at risk of cardiovascular issues. But that's not all. There's even evidence that omega-3s may improve insulin sensitivity, though the effects vary from person to person. How can you ensure you're getting enough omega-3s? The easiest way is through supplements. Choose high-quality fish oil or algae oil supplements that provide a combined daily dose of 1,000 to 3,000 milligrams of eicosapentaenoic acid and docosahexaenoic acid. For a plant-based option, algae oil is a great alternative for those who don't eat fish. If you prefer getting omega-3s from food, focus on fatty fish like salmon, mackerel, and sardines. Aim for 2 servings of these fish per week, as recommended by the American Heart Association. Plant-based sources like flax seeds, chia seeds, and walnuts are also good options, but their omega-3 content is in the form of alpha-linolenic acid, which your body must convert to eicosapentaenoic acid and docosahexaenoic acid. Unfortunately, this conversion process is not very efficient. There may be some risks involved. Omega-3s are generally safe, but very high doses can thin your blood. If you're taking blood-thinning medications, consult your doctor before starting supplements. Incorporating omega-3s into your routine is a simple yet effective way to lower inflammation, protect your heart, and improve your overall health as a diabetic. It's like giving your body the tools it needs to fight back against diabetes complications. Magnesium. You might think of magnesium as just another nutrient, but for diabetics, it's absolutely critical. Here's why. Magnesium is involved in over 300 processes in your body, many of which directly affect how your body manages blood sugar. It helps regulate glucose metabolism and supports insulin function, which are 2 areas where diabetics often struggle. Studies show that people with diabetes are much more likely to have a magnesium deficiency, and when your magnesium levels are low, it makes things worse. Low magnesium can increase insulin resistance, spike inflammation, and even affect your blood pressure. But what happens when you get enough magnesium? The results can be life-changing. Research published in Diabetes Care found that magnesium supplementation significantly improves insulin sensitivity, meaning your body uses insulin more effectively to lower blood sugar. Another study from the American Journal of Clinical Nutrition showed that magnesium helps reduce inflammation, which is a key factor in diabetes complications like heart disease and nerve damage. That's not all. Magnesium can also help lower blood pressure, a common issue for diabetics. High blood pressure puts extra strain on your heart and kidneys, which are already at risk when you have diabetes. By maintaining healthy magnesium levels, you're not just improving blood sugar control, you're protecting your entire body. So how can you get more magnesium? While it's found in foods like spinach, almonds, and black beans, it can be hard to get enough from diet alone, especially for diabetics. That's where supplements come in. Look for magnesium citrate or glycinate, as these forms are easier for your body to absorb. A daily dose of 200 to 400 milligrams is ideal, but always check with your doctor to make sure it's safe for you. Adding magnesium to your routine may seem like a small change, but it can make a big difference. It's like giving your body the support it needs to fight back against diabetes and protect your health. Vitamin E. Vitamin E is an important nutrient that often gets overlooked but can greatly help people with diabetes. Known as a strong antioxidant, vitamin E protects your cells from damage caused by free radicals, harmful molecules that increase oxidative stress and worsen diabetes complications. Why is oxidative stress so important in diabetes? High blood sugar creates the perfect conditions for oxidative damage, which doesn't just harm cells. It also causes inflammation, damages blood vessels, and speeds up complications like heart disease, nerve damage, and kidney problems. This is where vitamin E steps in. It fights free radicals, reduces oxidative stress, and shields your body from further harm. Research shows it does more than just protect your cells. Studies suggest vitamin E improves endothelial function, which is crucial for maintaining healthy blood vessels. For diabetics, this is vital because endothelial dysfunction often leads to heart disease. One study in diabetes research and clinical practice found that vitamin E supplementation significantly lowered inflammation markers, such as C-reactive protein, in people with diabetes. Vitamin E may also support better blood sugar control. While it's not a direct treatment for high blood sugar, its ability to reduce inflammation and improve insulin sensitivity makes it a helpful part of diabetes management. So how can you add vitamin E to your daily diet? Start with your diet. Foods like almonds, sunflower seeds, spinach, and avocados are rich in vitamin E. However, many people, especially diabetics, don't get enough from food alone. That's where supplements can help. Experts recommend a daily dose of 200 to 400 international unit of natural vitamin E for the best results. Always choose natural forms of vitamin E as they are better absorbed and used by your body than synthetic versions. But here's the shocking twist many do not know. But be careful. Too much vitamin E, especially from supplements, can cause problems like increased bleeding risk, especially if you take blood-thinning medications. Always check with your doctor before starting any new supplement. Vitamin E isn't just about avoiding complications, it helps your body stay strong. Chromium. This trace mineral might not get as much attention as magnesium or vitamin D, but for diabetics it's a game changer. This is because chromium is deeply involved in how your body processes sugar and uses insulin. Here's how it works. Chromium enhances insulin's ability to transport glucose from your bloodstream into your cells. Think of it as insulin's sidekick, helping it do its job more efficiently. When your body doesn't have enough chromium, this process can slow it down, leading to higher blood sugar levels and worsening insulin resistance. But the good news? Supplementing with chromium can turn things around. A study published in Diabetes Technology and Therapeutics found that chromium supplementation significantly improved insulin sensitivity and reduced fasting blood sugar levels in people with type 2 diabetes. Another study in the Journal of Clinical Pharmacy and Therapeutics showed that chromium picolinate, a highly absorbable form of chromium, can also lower hemoglobin levels, which is a key marker of long-term blood sugar control. For those struggling with insulin resistance, chromium offers a natural way to support your body's ability to manage glucose. And it doesn't stop there. Chromium has also been linked to reductions in cholesterol levels, which is important for diabetics at higher risk of heart disease. But how much chromium do you actually need? Most experts recommend a daily dose of 200 to 1,000 micrograms of chromium picolinate. This form is preferred because it's more easily absorbed by the body. And while chromium is found in foods like broccoli, whole grains, and lean meats, it's tough to get enough through diet alone, especially if you're already deficient. Now let's address a common concern. Is chromium safe? The answer is yes, when taken within the recommended dosage. In fact, chromium is considered one of the safest supplements for diabetics, with very few reported side effects. However, it's always a good idea to consult with your doctor, especially if you're on medications like insulin or metformin, to ensure there are no interactions. Adding chromium to your daily routine could be the missing piece in your diabetes management plan. It's not just about lowering your blood sugar, it's about helping your body work smarter, not harder. Vitamin D. Next on our list is vitamin D. Vitamin D is often called a sunshine vitamin, but it is not just about its nickname. Vitamin D is good when it comes to managing diabetes. If you're living with diabetes, there's a high chance you might be deficient in vitamin D. And here's why that's a problem. Vitamin D plays a critical role in how your body processes sugar and produces insulin. Studies have found that low vitamin D levels are closely linked to insulin resistance. What does that mean? Your body struggles to use insulin properly, which can lead to higher blood sugar levels. On top of that, vitamin D deficiency can impair the function of beta cells in your pancreas, which is the very cells responsible for producing insulin. And if that wasn't enough, low levels of vitamin D can increase inflammation, which worsens complications like nerve damage, heart disease, and kidney issues. The benefits are nothing short of amazing. Research published in the Journal of Clinical Endocrinology and Metabolism found that supplementing with vitamin D can significantly improve insulin sensitivity, making it easier for your body to regulate blood sugar. Another study from Diabetes, Obesity, and Metabolism showed that vitamin D can enhance beta cell function, helping your pancreas produce insulin more effectively. But that's not all. Vitamin D is also a natural anti-inflammatory, which means it can help reduce the chronic inflammation that often accompanies diabetes. This can lower your risk of complications like neuropathy and cardiovascular disease. And let's not forget its role in supporting bone health, an important consideration for diabetics who are at higher risk for fractures. Now here's how to make sure you're getting enough. The best source of vitamin D is sunlight. But let's be real. Most people do not get enough exposure to sun, especially if we live in colder climates or spend most of our time indoors. That's where supplements come in. Experts recommend taking 1,000 to 4,000 international units of vitamin D3 daily. This form is the most effective at raising and maintaining your vitamin D levels. But do you know the right quantity to take? Vitamin D is safe when taken in recommended doses, but it's always a good idea to check your blood levels with your doctor. Maintaining optimal levels around 30 to 50 nanograms per milliliter can make a world of difference in your diabetes management. Adding vitamin D to your routine isn't just about managing your blood sugar, it's about giving your body the support it needs to thrive. Trust me, this small change can have a big impact on your overall health. With vitamin D completing our list, you now have a solid guide to the vitamins and supplements every diabetic should consider. Each one plays a unique role in helping you manage your condition and live a healthier, more balanced life. The top nutrients we mentioned work together to protect your overall health. Have you been eating food with these nutrients? Share your thoughts in the comments below. Don't forget to like and subscribe to our channel. Also click on the next video on your screen. You won't want to miss it.